I'm really grateful for the giving back to pharmacy to Pakistan for giving us an opportunity to discuss one of the very innovative topics which were full of learning. I recently learned a lot from Miss Lee Xian, and it was entirely a different session. As per my perspective, it's quite informative for me. So moving towards the preparing next generation of the pharmacy leaders, the topic comes into our mind because that's the need of the day, and we believe that the country like Pakistan, where the pharmacy profession is struggling, the pharmacy profession is fighting and developing their roles, and they are moving in a very good speed, and we are very much hopeful that the profession will grow in upcoming few years, and we need leaders that can run this profession in a better way, in a more visionary way. So we will just go through that how we can go through from this one. So we all want to be successful in life. So we can ask ourselves, we would love to live like a leader, or we would like to live like a follower. So this is a question coming into mind, and you people can ask this question from yourself. So few of them will think about that they are the followers, and the few of them thinking about that they are the leaders or they are the future leaders. So we are talking about the future leaders right now. Usually followers are just following the instructions, and they pass their life with that because they don't take comes out of that box. So we will discuss. We want the new generations to be to take an opportunity and come out of the box and make an a leader. And we will discuss what's a basically leadership process is. Disclosure, I have no actual potential conflict of interest in relation to this program presentation. Pictures used in presentations are purely for educational purpose only. So leadership is not about the next election. It's about the next generation. So I repeat again this one, leadership is not about the next elections. Unfortunately, the scenario in which the pharmacy profession is working within the country is more towards like an election. The personnel who is elected is a leader of that profession. Instead, we are not talking about the new generations. We are not talking about the new skill set the people do have. We are not talking about the gold mines we have. We are talking about what we are now and what we occupy the things. We should make an examples, and we should make a space for the upcoming generations that can be a part of a uh, success of this profession in upcoming year within the country. So once again, talk about yourself. Are you a leader? Take an honest opinion. Yes, no, maybe, not sure, possible. And all of things are possible. Every situation makes you a leader. If you're a leader already leader, make or produce more leaders. If you are not a leader, think about why you are not a leader. You can maybe think about why you are not a leader. Not sure. That means you still not explore yourself. Possible. When possible? What will be the timeline when you will become a leader? So think on every grounds, and we should think about this one. So let's little bit discuss about the meanings of leadership. The few people said the leadership is an influence. That's it. Nothing more, nothing less. The behavior of individual directing the activities of a group towards a shared goal. That's a leadership. Not sure. The process of influencing the activities of an organized group towards goal achievement. Is that a leadership? A process of giving purpose to collective effort and causing willing effort to be expected to achieve a purpose. The last definition most attracts me. Leadership is about making others better as a result of your presence and making sure that the impact lasts in your absence. That's the beauty of a leadership. That you make change, you make something, you make a beneficiary for others, make changes life of others. Let's see how we can improve this one. Leadership philosophy. Leadership is not a position or a title. Believe me, we believe, unfortunately, the dilemma of the society within country that we believe that it's a title, it's an action, it's not an example. But that's the requirement. It's an action and it's an example. Leadership is a way of thinking, a way of acting, and most importantly, a way of communicating. The function of leadership is to produce more leaders, not more followers. I'm talking about the new generation right now. You have to become a leader and you have to make leaders instead of followers. It's a quick slide that shows that what are the functions of a leadership. Leaderships involve the guidance, solutions, vision, teamwork, direction, strategy, communication, and goals. I've gotten a lot of opportunity to interact with the new generation pharmacists. Got a chance to meet a lot of new generation in various universities, various practice places, and they always ask that they have a lack of a leadership concept with them. They are they need a guidance. They need some quick solutions. They need some visionary peoples. They think that teamwork is a waste. They ask they don't get any directions, don't know strategically their sound, communication, they are lacking with that, and no goals. So we need to think about leadership concept within this new generation. I've asked a few of the students, just give me the idea. What do you think? What's in a leadership? Somebody said it's an influence. Somebody says it's in a visionary. You said integrity, inspiration, charisma, courage, passion, empowerment. So you name it, and people think like that. So we have to collect and correct their thinking. That's what's actually leadership is required, and how this new generation can make it changeable. So types of leaders, we learned that leaders are by position achieved. Either if you are in a very good position, then you are a leader. Not sure. Leaders by personality, charisma. He's very good looking person. Whatsoever he's saying, you say, okay, that's fine. We will just follow you. It's a charismatic personality, nothing more, nothing less. Leader by moral example. Leader by power held, intellectual leader, and leader because of ability to accomplish things. Currently, what I feel, being a pharmacy profession, we need a leaders that ability to accomplish things. Leadership in pharmacy. A lack of leadership will mean that healthcare system pharmacy will no longer be in a position to enhance patient safety, to optimize medication therapies across the continuum of care, to make a real difference in lives of the patients that we serve. So you can see why leadership is important in pharmacy profession, because enhance the patient safety is the ultimate goal of every pharmacist who is practicing in a healthcare system. Let's just go through a few challenging that we face with the leadership challenge, and that's with belongs to changing pharmacy practice. Unfortunately, situation in Pakistan, we have in a weak healthcare system with a limited budget capacity. Obviously, GDP, we are not spending a lot of things on the healthcare system. Pharmacy is on the brink of an impending leadership crisis and the lack of young leaders. We can't see a young leaders. We unfortunately we saw people who make some positions and now they are representing as in a leadership. We have a professional responsibility to deliver care to our patients. We should think about patients. Whatsoever we are planning, that should be around the patients. Lack of strong leadership cause disengagement of members, making change even more difficult. Believe me, this is the most, you can say the punchline of this slide, that whatsoever I feel with the new generation, that they are they are in disarrangements because they are not following the right leadership. They are confused. One of the major challenges in changing pharmacy practice is a widespread basis that pharmacy profession is diverse. We have in multiple options. We have in academics, we have in a hospital settings, we have in clinical settings, we have in industry, we have in a marketing, you name it, in pharmacy profession. Now we are talking about space as well. So that's one of the challenges as well. Old Drug Act regulations, the role of pharmacy council, which need to be triggered down, uh, which need to be more towards the focusing on the developing of the human resource that we do have in the country. Pharmacy practice opportunities challenges. We have a very limited opportunities, and once that opportunities comes, that's not um, linked with the futuristic approach. That's not linked with the leadership approach. That's not linked with the human resource that comes up with a couple of years within a gold skills they do have. Lack of structure practice training program. This is the most, you can say, critical thing that we are lacking. So we have any training programs, but they are not structured, unfortunately, like pharmacy residency programs. Multiple institutions are just getting the residencies, but they are not technically structured one. How do you feel about non-pharmacists leading our profession? We can see a lot of space, lot of positions where the pharmacist work is done by some other healthcare professionals. So how you get in a chance to become a leadership role of the pharmacy, especially if you are talking about the next generation leadership. As I've said earlier, that healthcare system leadership as just a patient-centered approach. You can see multiple functions that's links with the that's required the leadership criteria, but that is around the patient-centered approach. So coming towards the next generation leaders, practical tip to get there. This is I'm talking about again for the generation who is about to come into the market, and they are talking about their future. They are considering about the future opportunities. Their future. They are talking about what they want to do. So if you want to be a good leader in your profession, you have to take these 4 steps. This I feel I've learned from multiple things, and this is the most suitable steps I can share with them. Step 1 is to develop a plan. I'll just talk about in upcoming slides. Step 2 is get involved. Step 3 is leverage a mentor. And step 4 is build your own leadership skills. Stephen Covey, excellent personality. A lot of things we learned from him. He said, begin with the end in mind. And believe me, I personally use this quote that whenever I would like to start anything, I think about the end. To begin with the end in mind means to start with a clear understanding of your destinations. Unfortunately, we have a generation which don't think about the things. They're not clear with what they are going to do. It means to know where you are going to, so that you better understand where you are now, and so that the steps you take are always in a right direction. So planning is the most important thing to start up. So let's take step 1, develop a plan. Most of the people, most of the students, they don't have their own plans, unfortunately. They just do copy paste. One of his or her friends having an opportunity, they just follow those opportunities instead to making their own plan. So we have to counsel, we have to guide them. So your mission statement will ultimately serve as a guidance for all your habits, routine, decision, and future goals. Focus is personal, not professional, because it's linked with your traits. Think of most of important values you want to express. Try your own mission statement. Make a 1 or 2 line sentence and revisit it annually. Think about that. Whatsoever you plan, or you are on that plan, or you diverted from somewhere. See an example to live life with integrity and empathy while being a positive force in the life of others. I would like to share one personal thing. One of in past I got in a training from one of the trainer, and he asked a very good question from the audience. He said, "Once you will die, what you want to listen about yourself?" So the question was very hard, and but the question is very good as well. What was your last introduction? He was a very nice man. He was very helping. He was very cunning. He was not a good man. So think about that. If you want your final last introduction, a very good, happy, charming introduction, work today, act today, plan today. So once you go into this world, the people think you in a positive way. Then you can't blame yourself that I was sorry, I got another chance. I'll do this one much better. So why not try today? So develop a plan. There are two type of plans. Everybody knows we makes plans of plans, and we are with, and fortunately or unfortunately, we are very good in planning, but we are not very good in execution. So try to make a plan for a short-term plan and for a long-term plan, and make a write up that plan. You will sometimes laugh with your plan, and you sometimes that will recall you, but where you want to go. So start writing. List the things that you motivate you. List your knowledge, skill, and experience. Incorporate your personal mission. Create a mind map as a guide. Start thinking of your legacy. Step two, get involved. Involve yourself. Either you work like a volunteer, make an bridging with the pharmacy association, committees, initiatives, state affiliation, mentorship, policy and advocacy, research. So whatsoever you're liking, whatsoever you're planning, you just have to get yourself involved with that. Explore career options. Don't waste your time once you get graduated, once you get your transcript, once you get your license, and then you start thinking that where should I go? Think today to what you want to do and how you can save your time. Seek out unique internship, rotations, program, pharmacy administration, clinical management, pharmacy association. I usually talk about 10 new generation pharmacists. Where would we like to go? So 10 out of 9 says, 9 out of 10 says that I would like to go to become a clinical pharmacist. So if they are clear, so they should work on that, how to become a clinical management skill like that. Pharmacy association, informatics, medication safety, whatsoever the things where you want to do, take a training, don't waste your time. Meet pharmacists practicing in your area of your interest. This is the most helpful thing which we learned after our graduation. We waste our time while we were graduating. We never get a chance to interact with the people who are practicing, people who can guide us, who can save our time, who can save our directions. But times now, because the communication becomes very fast, and the people get chance of interaction with the multiple people. So what I feel that the next generation is good in that. Participate in pharmacy organization, advocacy of the profession, networking with colleagues and leaders. Networking is the most important thing that helps you to get your direction in a right way. Build your CV, leadership positions, local, state, national, unique experience. Try to get some rotations, internship jobs, presentations, professional involvement, volunteer. But keep remember one thing, one brick, one at a time. Don't take things that I will just go all things in a 3 months time. Try, focus, and focus by having a learning and with original skill set. Instead, you get an E certificate or a D certificate. You should focus that what actually you are getting out of that learning or the time you spend over there. Leverage a mentor. Seek out mentors, but another responsibility, be a good mentee as well. Mentors can help you to identify the end point and assist you in creating your plan. My father was used to say, Umar, there is no shortcut of experience, but having a good teacher, or having a good mentor, you can make access or you can make success within your life. And try to find an effective mentor. Don't waste your time with an idealism or charismatic mentor. Try with a person who's basically helps you while you're getting your life in a good position. Build leadership skills. This is step 4. I have 6 minutes to go, and I hope I'll just cover this one. So build the leadership skills. I'll just summarize them in a 3 basic functions. One is the clinical, general, and administrative one. So managing up, down, across, and out. This is a practical slide. Once you are in a good position, once you are taking as in a leadership role, you have to work with your upside, downside, across, and out. So for a new generation, you work what you used to call usually a multitasking, but I personally don't believe in a multitasking. But you have to you capable You should have the potential to work 360 degree, that you have to believe that you work with your subordinate, you work with your higher authorities, you work with your peers, and you have to sometimes work just out of the box. So you can see managing across, be proactive as a team player, professional, making it trustworthy, establish trust, record a competence, dependability. So all these comes when you are talking about the managing things across. Once you're managing down, be reliable, consistent, fair, do mentor others, lead by example, provide feedback to help others. That's why I was talking about. You have to produce the leaders. Once you will become a good mentor, you'll start producing followers, which will eventually become the leaders. So managing up, that's the more strategical, technical terms where the leader roles comes in. Be familiar with the department mission, vision, strategic plan. You should be masters with your skill set. Until otherwise, you cannot come out of that. The role of leadership will be not fulfilling. Prioritize expectation and advocate for the most important. Negotiate mutual expectations. So I'll just show you this slide. I'll just not go one by one. You can see these things are helpful things which makes a good leader. For having a journal leadership skills, if you get a chance, every the skill having an individual training workshop for 3 days, uh, that's to make a master on that. So think about communication, flexibility, ethical, humility, feedback, positivity, everything having its own importance. And believe me, without these, you cannot make your journal leadership skills polished. Then comes the clinical leadership skills. Develop people, team builder and leader, develop a project plan, use to influence to gain support, evaluate program, identify areas of uncertainty, and assist in adaptation, foster communication and collaboration. And the third one is the administrative skill, leadership skill set. That makes a lot of things because you should be a good administrative, you should be having good clinical skills, you have a good journal skills. That makes a good a leader. That's the requirement uh, to become an effective person, an influential person. So now the question comes into the mind where you can learn these skills. That's the most important thing because everything what we just discussed that is that's available and most of them is we are familiar with that. So motivation to consider residency training. So being a worker in Shawkatana Memorial Cancer Hospital, our leadership role is that to develop leaders. So we make a residency program back 7 to 8 years, and we work on that how we can make or produce skilled human resource that can be a leader in a shorter time. Residency produce leaders, and you want to be a more effective leader. Practice skills, learn in school, learn from top practitioners, career flexibility through board experience. We basically appreciate our staff for a board certification. Self-awareness through feedback and coaching, refine journal leadership skills like time management, communications. So pharmacy residencies, the concept of residencies was started a few years back in Pakistan, but there was not a structured pharmacy residency program till date today. So being in the Shawkatana Memorial Cancer Hospital, we work on that. So we work first level, that's a postgraduate year one PGY residency. And what we learn from that, we have a customized pharmacy residency program built by institution. Then we exaggerate and then we make it a part of a international standard, and then we go for the ASHP accreditation residency programs in 2020. Now we are talking about the post-graduation 2-year residency program. So these two things will help to become next generation leaders. So think like you are a fresh graduate. If you done your Form D, so you have an opportunity to go for PGY1 residency or PGY2 residency after that. Or if you want to be a general practitioner and you want to be a specialty practitioner. So you have to decide yourself that where actually you want to go and how you want to be a future leader of this profession. Why a career in pharmacy administration? Opportunity to influence patient care on a larger scale. My personal interest was administration side, so I work and I try to excel myself on this area. Ability to lead important initiative to advance the pharmacist scope of practice. Ability to influence direction, funding, and implementation of the clinical program. Seek challenging and rewarding experience that can lead to growth and development of others. Make a difference in the life of our patients. That's important thing. Will you lead a change? We can lead the change that we believe in, or we can just position ourselves to be a force to accept the change being put on us by others. The choice is quite clear. We are going to lead the change, inshallah. So thank you very much. I'll be grateful once again for giving back pharmacy to Pakistan, so to give us the opportunity to discuss on this innovative topic. So if the people have any question, they can email us, they can inbox us, they can text us, and we can reply accordingly. Thank you once again.